Hi, Misty again. I'm back to continue my, um, my review of what's been going on. I was working on it earlier and I got to the point where I was talking to the oncologist. Can't remember what I said last, but, so have some of my notes here as to what all we discussed. One of the first things that she talked about was the oncotype testing. Oh, right. I think I said that the cancer center got a hold of me and wanted my consent to send it to California for the oncotype testing. So the oncologist here had the results for that, and we went over it. One of the first things that she told me was the markers that were tested from the biopsy had different results during the oncotype assay, I guess it's called, than what they got off the biopsy pathology report. The biopsy report said that there was 11% positive estrogen receptor, negative testosterone PR receptor, and negative HER2. Off the oncotype test, it actually all come back as negative. So that is simplified as triple negative breast cancer, which isn't very great because there's not as many treatment options, as my understanding, for that type of breast cancer. The other thing that she told me was the oncotype score is 63. Trying to remember what the numbers are for it off the top of my head, but I think something like 0 to 25, there's little to no chance of recurrence, the same cancer coming back. 25 to 100, it progressively increases the odds of the recurrence as the number goes up. So 26 would be a lower chance of recurrence than a 95. Well, my score was 63, and that is considered high risk of recurrence. So on that, it is highly recommended to do chemotherapy to treat any possible rogue cancer cells to try and prevent it from waking up and coming back. She said I can do the chemo in my hometown, and I would meet with her in 2 months to have another discussion as to the process of treatment. In my hometown, I would see a GPO, a general practitioner with oncology expertism or something. I met with them today, but I will get to that later on. There will be 8 cycles, 8 treatments of chemotherapy infusion, and it will be given in a dose-dense protocol, which means every 2 weeks instead of the standard every 3 weeks. Because it's a dose-dense protocol, I will also need to take what the heck is it called? Gastrofill, I think, something like that. It's an injection that I would take for multiple days after each infusion to help boost my white blood cells, to help prevent infection and keep my immune system strong, hopefully. There will be 3 types of chemo. The first 4 cycles will be AC, and the remaining 4 will be T-Tamoxol, I guess. That's the brand name. They shorten that for Taxol, I guess. They shorten that just to call it ACT protocol. Side effects: the AC, the first 2, is hair loss. The white blood cell is compromised and immune system's compromised, so that's why the injection. I have to take my temperature at least once a day, if not twice a day, to watch the first sign of a fever, so 38 degrees Celsius or higher. I need to get to the doctor or the emergency room if the cancer clinic is closed. AC can cause heart problems, so we need to watch for that. If there's any signs of it, they will do different testing to monitor it. The Taxol, the last half of the cycles, has potential to cause neuropathy, so tingling, burning sensation in fingers and toes, lack of feeling, lots of things that I really don't want to have, especially on a possible permanent, possibly permanently, I guess. One way to help prevent the neuropathy is to wear cooling gloves and booties, so they have ice packs in them to help reduce the blood flow in your hands and feet. I would need to wear these for the last 4 cycles. There's not a huge chance of neuropathy from the first 4, so the first 4 cycles can cause problems with your fingernails, so using the ice mitts and ice booties can potentially benefit the toenails, but it shouldn't have an issue with it causing neuropathy. With the hair loss, there is the option of cold capping. It's the same theory where they reduce the blood flow to the scalp, which will hopefully minimize the amount of hair loss. I have read some stuff that there is wavering thoughts on whether or not these cooling techniques are suggested. It can I guess protect some rogue cancer cells in those locations, whether it be the scalp or the hands or feet, from the chemo treatment, and have a chance of reoccurrence later because they weren't killed off during the treatment, they were protected. So for the hair, I think I can handle the loss of the hair and go with the reduced chance of the recurrence that way. But I do fear neuropathy, so I will be doing the cooling mitts and booties. I ordered those online. They arrived. I haven't taken them out of the box yet to check them out. I will be doing that tonight. I start my first chemo infusion tomorrow, so I will take them with me. And I'm still not sure about whether or not I'm too worried about my fingernails going bad, but I will bring them with me, and I'll make the decisions on that as I go. What else do I have for some notes here with the oncologist? Oh, because of my age, 50 years old, and younger automatically qualify for government funding for hereditary genetics for cancer. So not only breast cancer, but any kind of cancer. So I decided I wanted to go ahead with that. So got that in line. Actually today, while I was at my appointment getting lab work done, I also got the lab work done for that. I asked the oncologist about hormone drugs because there was signs of the ER being positive at the biopsy and then it being triple negative from the oncotype analysis. She said because there is potential of hormone that we will be doing hormone treatment down the road, and we will be doing radiation after the chemo is done because I had a lumpectomy. The margin, I think it was the lateral margin, anyways, the bottom of where the tumor was, the margin is considered negative, but it's only 0.1 millimeter from where healthy tissue is to where the tumor was, and that's too close for comfort for me. So the radiation will be a benefit in getting anything that was too small for them to detect. Let's see, anything else that I have written down? I think that's all I have written down from that appointment. Oh, when they called for the appointment with the oncologist, they called on a Wednesday about, I don't know, 10 or 11 in the morning. I think it was closer to 10, and said that they had my appointment set up for the next day at 11 a.m. So I had approximately 24-hour notice. One thing I thought was kind of weird was later in the day, on the day of my appointment with the oncologist, I got another phone call from the clinic, and they have scheduled my next appointment with her, which is 2 months down the road. So one was very short notice and the next is very long notice. So I thought that was a bit ironic, but anyways, gotta find the humor where you can. I have a whole bunch of papers here. I am just getting out of the appointment with the GPO, the general practitioner of oncology, or with expertise in oncology. Saw the cancer nurse and went through a whole bunch of stuff with them. We went through a whole bunch of papers, talked about a whole bunch of side effects, everything that's going to happen. Did the lab work today. They'll check my blood cell count and my platelets to make sure everything is good to go for tomorrow. It was a long visit. I think the appointment was at 11:30 and we didn't get out of there until 3:30. It was a long appointment. I'm not really sure what I'll say. There was a lot of information. One thing that is nice about the cancer clinic room is there's a bunch of big windows that look out into some green space, so there's some nice sunshine that comes in there, and I guess that's a positive to the space. And I don't know, at times I'll probably just look out the window and daydream about being somewhere else. Each chemo room has quite a bit of space, so you can bring a support person with you and they have their own little chair and stuff. Each room is open though to the nurse's desk so that they can monitor everything. They don't want you to feel like you're being forgotten about, I guess, and they want to watch for any side effects. While I was in there today, I got a prescription for nausea medicine. The doctor told me that they're quite expensive, so make sure that if I have any insurance that I can get that set up before and have them cover it, because it's something like $200 a pill. And I think I have to take them every day for I don't know how many days, but anyways, it's super expensive. Right now I'm just about to go into the pharmacy to get these new prescriptions filled and go home and try and get things set up for tomorrow. We've been needing to take two of our animals into the butcher. And of course, the only available slot that they have is to take them in tomorrow morning. So we got to try and figure out how to get that all done before my appointment for my first chemo infusion tomorrow at 11 a.m. I don't know. It's always crazy how everything has to happen at the same time. So anyways, take care, everybody. I will hopefully feel good enough tomorrow to give you an update. Bye.